sun damage and deep wrinkles. Dr. Barry Handler from Alvarado Hospital here to tell us about the latest in laser technology that's turning back the hands of time. That's what a lot of us like to hear. Good morning, Dr. Handler.
Good morning.
As a plastic surgeon, I know that you treat all different kinds of people for all different kinds of issues, but I want to talk about this new laser technology that you don't necessarily have to, you don't have to go under the knife for.
Yes, well, Pearl Fractional is the latest entry in what's called fractional resurfacing technology, whereby we treat only a fraction of the skin, and that allows a faster recovery for our working people who want to improve damage from the sun, brown spots, superficial, moderate, and even deep wrinkles.
Interesting. Okay, so it's not necessarily going under the knife. You're doing the laser technology, so the downtime you were saying is very, very minimal.
Yes, we use an erbium YSGG laser with a computer pattern generator, and this is the first time this laser has been used in clinical applications. But basically what it does is it makes little tiny micro holes in the skin. Kind of like you aerate your lawn to make it look better, you aerate your skin to make it look better.
Why not?
And another way of looking at it is all the little holes that you make in the skin with the laser are then filled with your body's own collagen. So it's kind of like getting collagen injections with your own collagen.
Wow, that is fascinating to me. We have a couple of pictures of the before and after, and there's really a marked improvement just from doing this laser technology.
Yes, I've treated probably close to 24 patients, and everybody's been pretty impressed.
Tell us about this patient here.
Well, this first lady is a rather extreme case. She would be a good candidate for a facelift, but that's not in her
Price
plans.
range or budget?
It's just not in her plans. And she has a lot of loose skin, a lot of deep wrinkles, and a lot of brown discoloration in the before photo. In the after photo, you see a smoothing of the skin, and you see an overall improvement in the complexion. Mind you, this is about 1 month after she's had 2 treatments, each spaced a month apart. The effects on the volumizing of the skin, the reduction of the wrinkles, go on for up to 6 months after you've had the treatment.
Very, very dramatic differences. Okay, I think we have a couple of other pictures, and of course this patient, she's a little bit younger, and wow, I mean, gosh, look at, it really looks dramatic.
Yes, this is a lady who's in her 30s, and she does like the sun, and she does have a lot of pigmentation in her before photo. The after photo is actually 3 weeks after her treatment. She's still a little bit pink, but that usually fades by 3 to 4 weeks. I don't know if you have the up-close shots, but a more dramatic improvement. She had some, if you look around her upper lip, she had some radial lip lines that typically smokers get. She's not a smoker, and these bothered her, and they were markedly improved.
What about anesthesia? I mean, I think a lot of people don't want to go under the knife because of the fear and the actual dangers that something could happen. Any general anesthesia or other for this treatment?
I've never used a general anesthetic for this procedure. Unlike some of the older resurfacing lasers where really, in order to make a patient comfortable and tolerate the treatment, you did need to put them under general anesthesia. Typically what I will do is apply a topical cream for about a half an hour beforehand, and most patients usually like a tablet of Valium or something like that to just keep them calm, and they can tolerate the procedure just fine.
As far as the downtime, like when folks can go back to work or resume their normal activities, is there a lot of redness? Is there scarring? I mean, how long does it take to just kind of get back to everything?
The first 3 to 4 days you need some sort of an occlusive dressing like Vaseline, and that's the hardest part. But typically if somebody has the procedure done on a Thursday or a Friday, they're able to get back to where they can put some makeup on by Monday or Tuesday and go back to work.
Yeah, and friends may go, hey, you look great. Oh yeah, I got a lot of sleep over the weekend. I got rested. Folks may not know that you've had a treatment done, but you just look a lot more refreshed.
Exactly.
That is nice. Okay, so restores the volume to the tissue and less side effects. So a lot of benefits to this. Cost-wise, what are we talking here?
It's really comparable to a lot of the other treatments out there. I don't think that, even though it's brand new technology, when you take a look at what it's competing against, prices are really pretty much the same. There hasn't been an increase.
Wonderful. All right, Alvarado Hospital and Dr. Barry Handler, great to have you in here. And you know what, laser technology, so many new wonderful treatments coming in. It's great to find out in sunny San Diego how we can kind of undo some of the damage that we've all done. Hate to say I used to use baby oil.
Oh my goodness.
You're probably cringing. All right, thanks so much.